right, guys, we're back at it again with another Nam Studios podcast. Today we have Dr. Mark Levitan with us in the house. How you doing?
Doing near perfect. Real
Near
good.
perfect?
Yeah.
Near perfect? Why near?
Well, always striving for that. But somebody once told me that if you ever do reach that level of perfection, then there's no longer any need for you to be on this plane of existence.
Oh, that's
So
true.
it's a good goal to aspire to.
Okay. So we know each other through BNI. We've been in BNI for over a year now.
Mm-hmm.
And you are our group chiropractor with Levitan Chiropractic.
Correct.
And how long have you been practicing?
Just almost 40 years now.
Almost 40. That's a
Yeah.
long time.
Yeah, graduated chiropractic school in 1985.
Okay. That was 3 years before I was born.
How do you like that?
So you graduated chiropractic school, but you had mentioned before that there was like this life-changing event that happened when you were like 24.
Yeah, well, that's when I decided that I was going to go to school for
Okay.
chiropractic.
Okay, and what was that?
Well, I was 24 years old. 2 years prior, I had graduated college with a bachelor's degree in psychology. And a bachelor's degree in psychology, I ended up selling life insurance.
Okay.
Don't get me wrong, nothing wrong with life insurance. As a matter of fact, I enjoyed it tremendously. Was doing really well with it, living the life. I was 22 years old, 23 years old, doing well in my career. Now, I have been a type 1 insulin-dependent diabetic since I'm 7 years old, okay? Always kept good control of my condition. And back in those days, we didn't have half of the knowledge and half of the technology that we have today. So it was a challenge, but I always managed to, keep my blood sugars in good control. And then a couple of years into working, I was 24 years old, living the life, had my own apartment, young, in the prime of my life there. And all of a sudden, my condition started to get a little unstable. The blood sugars started to spike and then drop. And, what you want to do with diabetes management and control is to keep level blood sugars as consistently as possible. But now I was going up and going down, and it was wreaking havoc on my health.
What was happening?
Well, I just, I would have a total lack of energy, listlessness. It was a combination of every emotion that you could encompass: fear, anger, worry. Because again, I'm 24 years old in a condition that I always had control of. All of a sudden now is directing how I'm feeling day to day.
Yeah.
And I went to all the experts, my medical doctor, who sent me to an endocrinologist, who then sent me to a diabetes endocrinologist. And I went to all the specialists. And what they told me was that you're no longer going to have control over your condition, that it's now going to control you. And, I'm like, well, wait a second. I start thinking about some of the consequences of uncontrolled diabetes, blindness, leg amputation, kidney failure. And I'm 24 years old in the prime of my life. And now all of a sudden that became the lowest point in my life. And I didn't know what to do. And a friend of mine who's a chiropractor suggested that he adjust me.
Okay.
And I'm like, yeah, but there's nothing wrong with my back. My neck feels fine. What do I don't need chiropractic. And he said, well, let's just give it a shot. Who knows? Let's get your body working the way that it's supposed to. And I said, but I've been to the experts. And he said, yeah, but what have they told you? So it gave me thought, and I started getting adjusted on a regular basis, a number of times a week. And over the course of a few months, my blood sugar started to stabilize.
Okay.
I started feeling better again. And now I'm like, okay, tell me more about this stuff.
Yeah. That's how I'm feeling. I'm like, now tell me more about this.
Yeah,
like,
because
how does that even work?
Yeah, at first I didn't want to hear it because I always thought it was about back pain and neck pain, but it had that change on my health. And I spent a little time being like a fly on the wall in his office to see what goes on. And then I decided I'm going to chiropractic school. So I went back to school for 6 more years
Okay.
to become a chiropractor.
Wow, 6 years. That's
Yeah,
how long
yeah.
it took?
I made the commitment to do that.
Okay.
Yeah.
Awesome. And so, like, tell me about that connection between, um, as everybody thinks, as I also think, when you go to chiropractor, it's like, ooh, I guess now on social media, you have those videos of people cracking the
Oh,
backs
yeah, the sound
the
effects and
sound
everything.
effects with the mics, and
Yeah.
people are like, oh my God, I haven't felt this way in so long. But you're saying it goes deeper into being diabetic and all these other things. So how does chiropractic or the body connect with that, and especially in the chiropractic
That's a
realm?
great question because the biggest misconception about chiropractic is that it's about back pain and neck pain. And
Mm-hmm.
our avenue of approach to working with patients is the spine. Okay, so that's why people think, okay, we're back doctors. But the reason why we work with the spine is because the spine houses the spinal cord, which is part of the central nervous system.
Mm-hmm.
If I can, this
Yeah.
model right here will demonstrate that. This is a plastic model of your
Yeah.
spine. Now, inside the spine is your spinal cord, which is
Okay.
a direct extension of the brain.
Okay. And is that like metal piece?
This metal piece would represent the spinal
Okay.
cord. It also helps to move the,
Okay.
the model
Yeah.
around, right? But that's the central nervous system, the brain and the spinal cord.
Yeah.
The most important system in your body, and so much so that it's the only system that's protected by bone, the spinal bones in the skull. Now, branching off of the spinal cord, as you see these yellow things right here, these are your spinal nerves,
Okay.
like the wiring system of your body. Now, they branch off, and there are millions of branches that come off of these that go to every single part of your body, every muscle, every joint. You've got about 40 trillion cells in your body that comprise every tissue structure
Trillion
and
with a
organ,
T.
and everything is under control of this brain. This is the hard drive
Yeah.
that sends the messages out through the nerves to every single part of your body. So
Okay.
in order for every function to occur, for you to move your body the way you are, for you to sense and feel certain things, there has to be direct and constant communication between the brain and every single tissue cell.
Okay.
If not, if there's interference to that, then there's a short circuit. And now certain parts of your body are not going to work properly. Whether you feel the pain, there may or may not be back pain, but there will be a state of what we call dis-ease, not disease, but lack of harmony, lack
Okay.
of balance in the body.
Okay. And then through chiropractic work is how you are alleviating that.
Right. What we do is we find out, see, what happens is because of certain stresses in life, there could be physical stresses like the bumps and bangs, slips, falls, car accidents. Sometimes, a lot of times, it's due to repeated postural stress. Okay, over the course of time, these bones will shift out of position. And when that happens, they're going to irritate the nerves. You've heard of a pinched nerve, right? So now wherever that nerve goes to in the body, it's not going to function properly. Got it? So let's say that happens in your low back, all right? There are branches of these nerves that go to the muscles in and around your low back and your pelvis. So now those muscles, of course, are going to be sore. They're going to be tight. You're going to experience backache. But there are also branches of those nerves that go down through the pelvis into the legs and into the feet. Oftentimes people have sciatica, or they have numbness and tingling in their legs or their feet. But there are also branches of those that go to the internal organs there. They go to the lower digestive tract. They go to the reproductive organs. They go to the urinary tract. And people wonder why over the course of time they're developing irritable bowel syndrome.
Yeah.
Or women with chronic low back issues often have menstrual disorders. And now understand that chiropractic is not a treatment or a cure for any of those conditions. It's merely a way of reestablishing the communication between the brain and the body parts. So now the body can do what it's designed by nature, by God to do, and that is to self-regulate, to adapt to the environment, and to heal.
Okay. That's awesome. So, like, now what do you say to the people who have the misconceptions that are just like chiropractors aren't real doctors, they aren't PhDs? Because the way you explained it makes so much sense. And obviously, you spent 40 years in this field. you're very, very well versed, and you've told me some stories of how chiropractic work has changed people's lives. But like, what do you say to those people with the misconceptions?
Well, I love when I encounter that because there's nothing better than when you can explain something to somebody and they see things in a different light. They have that aha moment. So one of the most common misconceptions is that chiropractors are not real doctors, or as we joke, RDs, right? And yeah, we're not MDs. Okay, those are medical doctors. We're not MDs no more than podiatrists are not MDs or dentists are not MDs. We're all doctors. We have a doctoral degree and we're licensed by the same state education department. It's just a different specialty. So medical doctors, they do great work, okay? They have more specialization in pathology, disease, pharmacology. Chiropractors might have an equal number of curriculum hours in the program, but maybe more emphasis on spinal biomechanics, physiology, radiology, courses of that nature. But yes, we're not MDs. I never professed to be an MD. Proudly, I'm a chiropractor, a DC, doctor of chiropractic.
So how does chiropractic at all also connect to, gut health, gastroenterology, that kind of thing as well?
It plays a big role in it. There's a common question is, hey, doc, can chiropractic help with this? Is chiropractic related to this particular organ system or that? Understand that every single organ system in the body
Connected to the spinal
is directly controlled by the brain. Now, you mentioned gut. Gut health is imperative to overall health and well-being. People think that gut health is really all about digestion, and it has a lot to do with it. But the biome or the healthy bacteria in your gut are responsible for so much more than just digestion. They're responsible for your immune response. They're responsible for the production of neurotransmitters, and those are the chemicals that actually allow the brain to communicate via nerve cells. So you have to have a healthy gut for all of those processes to happen.
Okay. And so as you've went through these 40 years of chiropractic work, how has the technology advanced with you? Are you using any of that new technology? Is there new technology?
Oh, yeah,
in
there's
chiropractic?
new technology. I'll give you a little history of chiropractic. Chiropractic, even though spinal manipulation is one of the oldest forms of healthcare in the world, back in ancient times, they were doing crude, but some type of spinal manipulation. And it was even Hippocrates, ancient Greece, the father of modern medicine, that said, look to the spine, for there is the requisite to health. Chiropractic as a science and as an art and a philosophy was actually established in 1895 in Davenport, Iowa. A Dr. D.D. Palmer, who was a magnetic healer. He was like an energy healer at the time, but brilliant in anatomy and physiology. He was talking with the janitor in his building who was deaf. And the janitor told Dr. Palmer that 17 years earlier, he was doing some work, lifting or pushing or pulling something, and he felt something pop in his upper spine. And since that time, he wasn't able to hear. So Dr. Palmer said, do you mind if I take a look? And he looked at his spine, and he wrote in his journal that he noticed that there were vertebrae that were, quote, racked out of place. And he said, well, let's see what happens if I rack them back into place. And so with Harvey Lillard was the janitor, with his permission, he adjusted them. And it might have been pretty crude at that time because it wasn't really developed as an art yet. But what happened was, we don't know for sure if it was 1 or 2 or 3 adjustments, but his hearing was restored. He was now able to hear the horses and buggies in the streets below.
That's amazing.
So now they actually thought that they found the cure for deafness. So
But that was
what
just
happened?
his nerve.
All these people came to Davenport, Iowa to get their hearing restored. And some of them it worked and some of them it didn't. But they noticed that other health challenges that people had, whether it was respiratory, digestive, immune, that they were starting to stabilize and get better. So Dr. Palmer reasoned, well, it's the same treatment. I'm racking the spine, and yet all these conditions are getting better. They must have a similar underlying cause.
Yeah.
And that's when he looked to the relationship between the spine and the nervous system. And that was the birth of chiropractic, and started the Palmer College of Chiropractic, which is still in existence in Davenport, Iowa.
But one thing I'm hearing from you is that, you know, all these people who have ongoing lingering systems, those all sound like, I wouldn't say older individuals, but individuals have been through the wear and tear of life, whether you're 20, 30, 40, 50 years old. But you also adjust children. How does that help in children, and being that, you know, they're brand new bodies, like
Yeah.
they could tumble and fall and be fine. Like, I don't think they have a pinched nerve as easily as I would at the age of 36.
But that's where you'd be surprised. I love working with the kiddos because that's where we make the biggest difference and biggest impact on their young and developing bodies. Remember, when the spine is out of alignment, interfering with the nerve system, now that's called the subluxation, vertebral subluxation. Subluxations are caused by physical, emotional, and toxic stresses that we're exposed to. Doesn't matter what age you are, newborn, elderly, you're exposed to stresses and your body can subluxate. As a matter of fact, they've done research, this is medical research, that has found that one of the most physically stressful events in anybody's life is the normal vaginal birth delivery.
Okay.
Because the baby, of course, with the doctor assisting, turning and pulling and twisting the head, there's been a number of studies, and they found that over 80% of healthy newborn babies have subluxations in their upper cervical spine. And it makes you
Just
wonder.
from the first thing they did coming into this world.
Yeah, and then as they get older, infants, toddlers that are motoring around, who bumps and bangs themselves more than kids? And like you said, they're not complaining of back pain or neck pain, but the most dangerous subluxations are what we call the silent ones, because they may or may not cause the muscle pain in the localized area, but those branches of the nerves that go to other parts of the body, there's going to be some dysfunction there. It's creating a state of imbalance in that body. And it makes you wonder why so many kids are on medications for allergies, asthma, hyperactivity, bedwetting, colic, ADHD, so many ailments that these kids, they're kind of put into this pharmaceutical rabbit hole, and they're taking a lot of these medications, sometimes unnecessarily.
How do you convince a parent to bring their kid, whether it's 6 months old or 16 years old, to you? I mean, I've known you for over a year. So, and we meet almost every Tuesday at BNI. We also do your marketing. So we're out there trying to teach people. But before this, how do you convince a mother who has a first-time mother who has a newborn or something to bring their kid to you? Because even for an adult, that's a scary thing to say, like, hey, let you, I wouldn't say play, but let you fix my spine, because everybody knows spine is important.
Right.
Yeah.
Yeah,
Like,
people instinctively know that,
yeah.
but they overlook it a lot of times. And you're absolutely right. It's a leap of faith for parents to want to hand their child over to me. Admittedly, a lot of the children that I take care of, I've already taken care of the parents. They're already seeing what a difference chiropractic makes, not just in their aches and pains here and there, but now they have more energy. They're sleeping better. Their digestion is better. They're not getting colds and flus as frequently as they once were. So they see what an effect it has on the health and well-being of the body. And then it's a matter of having a dialogue and showing them, like I'm doing right now, and explaining just how the body works. When you adjust a child, it's a different kind of procedure. It's very, very gentle. The newborn babies that I adjust, the amount of pressure that we might use to do an adjustment is kind of like if you're shopping, you're feeling to see how firm a tomato is.
Yeah.
That's about the amount of pressure that we use.
Yeah, I was always under the impression that when you go to a chiropractic doctor, it's a 30 minute to hour session, but you were telling me it's on 10, 15 minutes a session.
Yeah, well, it depends on what kind of procedure
Hmm.
and the adjusting technique that the doctors do. There are literally hundreds of different ways to adjust the spine, all of them proper and successful, but it doesn't take a long time to adjust. Sometimes people are going for care, and the doctors are using a lot of therapy modalities, maybe the heat, the ultrasound, the muscle stim, and all that, the stretching, and that can add time onto a visit. But it doesn't take long to adjust the spine and correct a subluxation.
Mm. I often think of chiropractic work maybe on the same scale or level as acupuncturists. Is that something that you ever looked into as well, or that you work with any acupuncturists? Can you tell me the difference
Yes, well,
between the two?
I have worked with an acupuncturist. As a matter of fact, I shared office space for a while a few years back with an acupuncturist. And acupuncture is very effective. Acupuncture has been around for thousands of years.
Hmm.
Both chiropractic and acupuncture, as well as other holistic approaches to health, have a common underlying philosophy in that the it's the difference between vitalism and mechanism.
I like
Okay,
that
so
saying. Vitalism and
so
vital. Say that again.
vitalism
Okay, and
and mechanism.
okay.
Okay, or the vitalistic approach to health versus the mechanistic approach to health, and this happened a few hundred years ago with the divergence of healthcare. The mechanistic approach to health basically maintains that the body is really nothing more than the sum of its parts. And if there's an issue over in this part of your body here, then we got a specialist to take care of that. We'll give you something to make that feel better.
Hmm.
If this is going wrong over here, then we'll give you something to make that feel better. Or maybe if that doesn't work, we'll take that thing out.
Hmm.
Okay, it's that mechanistic approach is what evolved into modern day allopathic medicine. Okay, traditional medical approach. The vitalistic approach to health maintains that the body is really more than just the sum of its parts, but the body is an ever adapting, evolving organism that has to meet the demands that are put on it, and that it has this inborn wisdom, this ability to maintain order and balance and to heal. And that vitalistic path of healthcare is what developed into chiropractic, acupuncture, homeopathy, other holistic forms of healthcare.
That's so interesting
Yeah.
because me personally, I think I talked to this a while ago. I have hand pain, literally in this part of the hand.
Mm-hmm.
Um, that makes me think that I might have a pinched nerve, or I've even went and seen if I had something in here like a splinter. The MRI didn't pick up anything, but I constantly have hand pain here, and I also have sinus, like not pain, but constant sinus problems with phlegm and everything. And I'm already at the point where I'm just like, I might need someone to cut open my hand and see what's in there, or I need to just go get my nose, a surgery on my nose to, what do you call it? I forgot the surgery on your nose. But to do that, but you're over here making me think maybe I should just do chiropractic work for a couple of
Well,
weeks and see what happens
it could be
without
worth
cutting myself open.
right. It could be worth looking in to see if there's a relationship with your nervous system, with what's going on,
Yeah.
because after all, the nerves in the neck, the cervical spine, they control not only the eyes, ears, nose, throat, sinuses, everything in and around the head and the neck, but also down the shoulder into the arms and the hands.
Yeah.
So if you do have subluxations in your spine, that could very well be causing that.
Yeah.
So before you start putting pills, lotions, and potions in or taking things out, maybe you'd be better off, like what happened with me, with trying a more conservative approach
Yeah.
and see what happens.
So you said pills, lotions, and potions. You do have a saying that you say every week. It's where you release your brakes.
Release your brakes.
Okay.
Right.
When did you come up with that?
Oh gosh, I came up with that years ago, and I might even have heard it somewhere else. So I don't want to unnecessarily take full credit
Well.
for it, but it's an analogy. And I often, and I have a big sign up in my office that says "Release your brakes." Most of us at some point in time have driven our car, and we notice that we're hitting the gas, but it's just a little sluggish. You know, it's not accelerating the way that it should. It's dragging. And then you look down and you notice that your emergency brake is on. So you pop the brake, and what happens to your car when you do that?
Just feels a lot better.
Well, right, it accelerates and it just like propels forward, right? So I tell people that if you're subluxated, if you have nerve interference in your spine and the brain is not communicating with your body parts, then you're living your life day to day with your emergency brake on. So when you get adjusted and you release that nerve interference and reconnect the brain with the body parts, now all of a sudden every system in your body starts to accelerate and hum the way that it's supposed to. And then you start to experience a greater level of health. So we're releasing your brakes.
Okay, release your brakes. Is there anything, you know, if you go to a physical therapist, you go to a physical therapist and, you know, they always tell you, oh, you should do these exercises or these movements at home because it helps you feel better. Is there anything in chiropractic that anybody could do at home, like right now or whenever they're free, just to feel like a little better that you would tell them?
Sure. Well, you know,
Is it just
I
stretching?
recommend specific exercises for virtually all my patients. As part of our corrective care program, it involves stretching exercises, strengthening exercises. We focus on posture a lot in our office, so postural corrective exercises as well. But they can't, any exercise at home cannot replace
As you say,
the spinal
I'm fixing my
adjustment.
Posture to set up right now.
Yeah, now you're sitting upright, right? I find that when I say to people, ask yourself if you're sitting or standing as tall as you can, right away they start to correct their posture. But yes, to your question, we recommend exercises at home for everybody. It's part of the rehabilitative program that we do. But it's not a replacement. If you've got something going on in your spine, if you have subluxations, you could stretch all you want. You could do as much yoga as you want. You could exercise as much as you want. But if there's nerve interference, your body's not going to be getting the full benefit of any of those other techniques if there's nerve interference.
Okay.
But as an adjunct to correcting the subluxations in your spinal positioning, absolutely exercises are imperative.
Okay. And I mean, as I said before, 40 years is a really long time. Like, what do you credit making your successful career through COVID, through the 2008 financial crisis, through whatever happened between, in, or after that? Like, what is your secret?
Basically, a commitment to what I do. And a certainty about what it is that I do with chiropractic and the impact that it has on people's health. As we go through different phases of life, different eras of time, there's going to be stresses and challenges out there, whether, like you mentioned, COVID, whether it be the financial. People are always under certain degrees of stress. And I'm talking about physical stresses that we encounter, the bumps, bangs of life, postural stresses, emotional stresses, going through hard times like COVID did a number on people. So there's an emotional component to that. What happens when you're tense and you're irritable and you're uptight? Your muscles tighten up. They pull the bones out of position. And that's not even mentioning the hormonal influences of that stress. And then there's toxic stresses that we're all exposed to, chemical, all the garbage in our foods that fortunately we're starting to wake up to some of the dangers of the foods and side effects of medications, different environmental factors that our body can no longer adapt to. So during those times, people were undergoing a lot of different challenges, and it was affecting their health. People are always going to want to be healthier. And I always stayed consistent and firm with the message of what chiropractic can do in terms of your health. So, yeah, there were challenging times along the way, but just my belief and confidence in what I do and the certainty of the effect that I could have on people, that's what makes it easier.
Here's a really good question. Does the chiropractor go to a chiropractor?
Every week.
Every week?
Yeah. Well, like I said, back when I was 24, I mean, it had that impact on my life.
Yeah.
And I was going 3-4 times a week
Okay.
for months. And when I saw that happened, and I then chose that as a career path, there was no way I was not going to get adjusted on a regular basis. And what I do is physically demanding. You know, and a lot of subluxation patterns and postural stress comes from some type of occupational stress and demands, whether you're an electrician working overhead all the time, a plumber working this way. I'm constantly using my body to adjust. If I don't get checked and adjusted each week, one day I'm going to be down there adjusting, and I might not get back out.
Yeah.
So, and I want to express my full health potential.
Yeah. Okay. So how do people find you? Where are you located? How do people find you to set up an appointment to release their breaks, as you say?
Sure. So my office is located in East Northport, Larkfield Road, 406 Larkfield Road. LevitanChiropractic.com is my website. I'm on Instagram, Facebook as well. And really enjoying the posts that you guys are creating for me. So there's ways to contact me, and be happy to answer any questions that people have, and maybe dispel some of the misconceptions, and some of the people are starting to now look through a different lens, a different paradigm about what healthcare really is, and looking for more rational answers to what's going on.
And do you take any insurances or anything?
Well, it depends on what insurances there are. I don't participate in every plan. There are 88 different insurance plans, and some are good and some are bad. But understand that the insurance companies, their main concern is showing a profit to their shareholders each quarter. So in terms of benefits for chiropractic or other types of healthcare services, they're usually going to be limited. All right. So there's, it's a matter of cost containment in some areas. But whether a patient has insurance, has no insurance, we always make it affordable.
Okay.
We never turn a patient away for financial reasons.
Awesome. All right. Thanks. I appreciate you coming, Dr. Mark.
Yeah, pleasure to be here.
Thanks.